And we are live. Hi, everyone. Happy Friday. I told you guys this week we're going to be intentional and I'm going to be selfish, okay, in celebrating my profession because this ones have been amazing through it all. And before I go in, because I always intend that we do this shortly, and this is Friday evening, so you guys will have time. So my name is Sonia. If you're joining us live, do help us know or keep in tab where you're watching from. Let's know how global we are. Okay. So no, with no further ado, you know me already, but I'm gonna introduce you. The person that have all it takes to answer all the leadership questions when it comes to nursing. I know that this part is something she's so passionate about because most times people tend to limit us to the caregivers and not the leaders that we are in all sphere. Okay, so with no further ado, here we have Mary Kay.
Oh, please. Hello,
Tell us about yourself a little bit and let's go into the discussion.
hello. I am Mary Kate, and I'm a nurse educator by profession. I'm a professor of nursing, so it's great to be here. When I got the invitation, I was like, but nursing week starts, but I know US and Canada celebrate different. So now it makes sense, right? Because I'm like, nursing week doesn't start till Sunday. But I'm glad to be here. This is, a topic that's really underestimated, and we shine a light on it today. So welcome. I'm glad to be here.
Thank you. So we're going to go to the first questions. So I always, like I mentioned initially, that sometimes people tend to look down on the career in terms of the whole thing is about bedside, be it community level or hospital level. So do you believe nurses are truly seen as leaders in healthcare of today or just like the carers they were in the Florence Nightingale time and age? Yeah.
Yeah. It's a very good question. It's funny you ask this question because one of the courses I teach is nursing theory, right? And we're comparing back in those days, in the 1910s, with the
Mhm.
Florence Nightingale and nursing today. I think we have come a long way. We have come a long way into literally screaming in the society and the community we're at that we are more than people that changes the depends and the diapers and just give medications, and nurses are basically the leaders of tomorrow. That mean that we are where we want to be. Mostly think of places like Africa and look at the responsibility of the nurse. The doctor is the person that is high above the god of the healthcare that gives orders, and
Mhm.
nurses basically just do what the doctors say. But in today's nursing, especially in the diaspora, you and I can testify that our scope of practice is huge. We're talking about RNs in Ontario prescribing,
Yeah.
so we have come a long way, but absolutely our job is always underestimated.
Mhm.
And when you say, oh, I'm a nurse, the next question is, which hospital do you work? And
Mhm.
usually that used to take me off, like, I don't work in a hospital, right? So no, the society don't know what we do. That is just the truth of it.
Yeah.
Yeah. Yeah.
Okay, so the next question is what does leadership in nursing look like today beyond the management title?
Yeah. Oh my goodness. Like, it's this question is so vast, and I can use 5 hours explaining about leadership. So I'm trying to just cut it down. You know, Usually when we talk about who a leader is,
Mm,
it's about a nurse manager, the charge nurse, the administrator. That is what we think about leadership, right? But leadership actually start in nursing at the PN level, right?
mhm,
So leadership in nursing, we talk about transformational leadership, right? Who is the transformational leadership? The person who can mentor people, the person who can, guide and direct people with the same goal. That,
Go.
to me, that is what a leader is. A leader is not the manager, you know
Mhm,
It's not the autocratic type, but a leader is someone, one, that person have a vision, a mission, and is willing to learn, even when they are older or have more expertise than
Mm-hmm.
the entry to practice nurse, right? So, nursing, there's more to nursing leadership. And of course, nurses are the leaders of our healthcare
Mm-hmm.
today, right? We are the biggest staff in every healthcare globally, right? So nursing leadership is basically, leading not just nurses, but the interdisciplinary team into, strategies and innovations to make sure that our patients get the best,
Right. Yeah.
right? That is what nursing leadership is to me.
Yeah, thank you that you touched that part where you have to tell. Just remember when I did my last placement and
Yeah.
I have the Europeans coming. I was still doing my consolidation.
Yeah.
And when they came in, they're like, oh, you're going to work with her. And from nowhere, I
Mhm.
just find out I'm precepting, even when I'm under a preceptor.
Yeah. Yeah.
So you're practically undoing and giving back all that you have gained. And no one tells you, oh, you need to prepare for this. So the leadership is imbibed even as we're going through the courses, you're going
Yeah.
through the whole clinical placement and all that.
Mhm.
Whatever you learn as a nurse is not a quality that we hoard. It's something
Yeah.
that we always give back, to put back,
Absolutely.
and to lead in any sphere, no matter the level that you are.
Mhm.
Thank you that you touched that part.
Yeah.
Now, in what ways do nurses advocate not just for patients,
Mhm.
but for communities at large?
Yeah.
Because most times people don't understand the value we like,
Yeah.
how we are change agents, even in policy making, all the ethical management and in all this sphere.
Yeah.
Always people, yeah, like I mentioned, they look down on everything is just you on the bedside with patient, forgetting that we have a huge responsibility in terms of policy making and
Yeah.
management at large.
Yeah. Absolutely. It's so interesting. So before I went to academia, which is, about 6 years ago, I still sit, but not in the capacity that I was before I went into academics. I sat on the provincial council for, advocating for finances for kids with complex needs, right? And when we are introducing ourselves around the table is MPs and people with banking experience, and there are two nurses, and you will never think that a nurse will sit on a council like that, right? So policy making is huge, and someone will say, oh, but I didn't go back to school and I just have my degree, and that is enough, right? So when we talk about influencing change and advocacy for our patients, it's as simple as doing chart reviews.
Mm-hmm.
It starts from there, going through an order and knowing that the doctor ordered 25 milligrams of Versed instead of ordering 5 milligrams. It starts from there, right? So advocating is not just, talking about our patients and, advocating for them, but it's looking outside the scope of your practice, right? What can be done? Sitting in councils, even something as simple as the safety committee,
Mm-hmm.
you know, advocating for, more sanitizer dispensers, for example, for your
Mm-hmm.
unit, advocating for nurses themselves, because sometimes we forget that we have to be our own advocate. So, when I used to work in Emerge, they have a policy that you cannot do back to back 12 hours, more than 5 12-hour shifts. But then you see nurses doing back to back like 10 12-hour shift in a row, right? So the advocate, who's a nurse leader, will, go to a charge nurse or HR and say, you know what, this does not go according to organization protocols. How
Mm-hmm.
can we make better? And sometimes bring in research, right? Because you cannot say, okay, maybe we should check the blood pressure every 15 minutes instead of 30 minutes. What is your evidence?
Mm-hmm.
What does literature say? What are the research that can back that up, right? So I would say an advocate is not as you said, an advocate, not just for our patients, for ourselves, for the nursing profession, and for the community at large. Those of us that enjoy community nursing, right, and enjoy, public health. I always tell my student, you have a community as a patient. Maybe you might be attending to one patient, but you might be tailoring to all the community and advocating for resources and making
Mhm.
sure there's that equitable care. Yeah.
Yeah. Yeah. Thank you so much. Like I mentioned, we're always do underestimated. So why do you think nurses are often underestimated despite carrying so much responsibility?
That's a very good question. I mean, if you're a nurse and you're watching me, you probably hate me for this, but it starts with us,
Mm-hmm.
right? You hear nurses say, I am just a nurse. Oh no, I'm just a nurse. And a patient will say, oh, why did the doctor say, I don't know, I'm just a nurse. The way we carry ourselves, right? And also, I think the public have a lot of trust in nurses to the point where we have become complacent to take
Mm-hmm.
whatever is thrown at us, right? For example, if you are being abused by your patient and you don't say anything, you don't get your assignment changed, you don't document, it's going to happen. So patients will look at us and say, you know what? They take whatever I give them. So this is what. And also, I think a lot of us, we have the mindset, nurses have the mindset, I just want to get through this 12-hour shift. I don't want drama. So little things that can be tackled, that can be taken into committees, that can be documented, it is not done. And you and I know, once it's not documented, it ain't happen. Right? So I think so I'll say some because I can't generalize, or have become complacent in what we do, that I just, you know what, nursing is hard enough. I just don't want stress. It's not a big deal. Just get over my 12-hour shift and go home.
Yeah.
Yeah.
Thank you. So how can nurses transition from just working shifts to building impact and legacy? Like you mentioned, sometimes it's just about us, but most times some people will be like, you know what, let me just get done, whatever happened, let me just go. I just want peace, because I know sometimes they don't want to even waste time chatting it or documenting it
Yeah.
or even escalating it to the next authority. They just want to, peace, I go. And it keeps happening, like you mentioned. How can nurses transition from just shift work to actually making impact, building impact and legacy in their career?
That's a very good question. You know, it's funny. And I said, there are some people who have very special place in your heart, because I should be lying down right now. Yesterday, I was in emergency. Actually, I was the patient.
Uh-huh.
I was the patient. And just typical Mary Kay, we started having conversations. And this nurse have, worked in Emerge for about 35 years. And she said she's
Mm.
going to retire in 2 years. And I asked her, and I said, what are you going to do when you retire? And she said, I'm going to go back home. It was a Filipino lady. She said, I'm going to go back home because the standard of living in Canada is too high. And it's triggered my reflection. And I'm saying, you've basically worked all your life. And I'm not sure if you established something back home, but you're going back to square one. Because if you don't have retirement savings, then you are getting less than $1,500 for Canada pension plan every month. And of course, it's not going to do anything. So we talk about reflective practice, right? In nursing, reflective practice is just basically sitting with yourself and asking yourself questions and being vulnerable and honest. Because I think until that happened, there is no financial legacy here. And usually when we say it, people will say they are back again. But the truth is, if you don't put things in place to trace those financial legacy, you'll be 65 and 70. And I always ask nurses, are you going to be willing to wake up at a 65-year-old on a winter morning to go for a 12-hour shift? Right? If it's yes for you, fine. But I think it starts by reflection, going into your place of solitude and asking yourself. And that's what I did. Yes, I've been in, a nurse for 18 years. Believe it or not, don't focus on this face. I have been in, and when I decided to start something new, not quitting nursing, I asked myself these questions. And I asked myself, do you see yourself working full time after 65? Because the truth is, it's paycheck to paycheck, which means there is not enough room financially for you to save, for you to invest, for you to get asset. Let's
Mhm.
face it. No matter how much you make, the 9 to 5 does not cut it. So nurses have to have that reflection, this time not professionally about patient and nursing care, but your own financial journey, and ask yourself questions, because it's only you who cannot lie to yourself,
Yeah.
right? And looking at where you want to go. And if it's not going to happen and you have to start something new, then being that, person who is vulnerable enough to learn how that can be done. Yeah.
Yeah. Thank you. You see why I said that you're the right person for this. So, guys, so before we get to the final one, what challenges do nurses face when they are stepping into leadership roles? Because, like I shared it with someone yesterday, I said what I see now is not about nurses eating their young anymore, because this generation collaborate a lot with each other. They're
Yeah.
willing to give back, they're willing to support. But what challenges do you think we face when we want to step into that leadership role,
Yeah.
to be leaders, looking at the people who have been there for years
Yeah.
and then transition for them to retire? What challenges do this, we face as we climb those ladders?
I think, you and I, our generation, millennials, right? One challenge is having so much things in your hands. Take your life, for example. You have little kids, I have little kids, right? We have responsibilities sometimes of our parents, right? If you are from the diaspora, pulling us from back home, and our responsibility here pulling us. So that, you know, telling yourself, I have too much on my plate, that with the time constraint, that's one. And also that everybody doesn't like change. And I think one thing that is very different with nurses is that we get so used to doing things the same way that it's hard for us to change. So
Mhm.
you have that registered nurse who have worked on that unit for about 20 years and they don't want to be a charge nurse. Yeah. So then the 19-year-old suddenly comes as a charge nurse and it's a problem, right? Because they don't want to learn something new. They are comfortable. I think it's a comfort zone. Nobody like leaving that area,
Mhm.
right? And I think the third thing is about innovations. We all know, like when I was in a specific hospital and we moved, I think, from Sunrise Clinical Manager Documentation System to Epic, I almost quit my job. In fact, every nurse there in their mind quit their job because we didn't want to do it. We are used to a specific way of documenting, so we
Yeah.
don't technologically want to. And I always say, if you want to be a nurse leader, you cannot take AI from it. I'm sorry.
Mhm.
You cannot take other means of innovations technologically. And that's why we have there's actually someone who's being hired, a nurse informatician. In our time, there was nothing like that. Who's an
Mhm.
informatics are people who are, they are not in nursing. But now people are specializing in informatics, right? So we have to open our minds to new things and new innovations,
Yeah.
technology. You can't take that away.
From
One
nothing.
of my students last semester was telling me that where they are, specifically Humber River Hospital, we have robots bringing sheets and water to the
Mhm.
clients' rooms. And
Mhm.
it's not something which would have happened when I finished nursing school. Robots,
Mhm.
like how? Right? So I think it's more of change, learning something new, innovations, and moving from our comfort zone. And of
Yeah.
course, time constraint with personal responsibilities and stuff that might move us from going
Yeah.
a leadership role.
When you mentioned nurses moving things or robots,
Yeah.
here robots do neurosurgery and they are very precise. I'm telling you that the robots do the whole neurosurgery. Nobody cuts in. The robot does its own thing precisely, moving away from the veins, the artery, everything to get out whatever is in there and suture back. That is the era that we are. And
Mhm.
that's why I love those always the time, like I mentioned, we have to think beyond the
Yeah.
caregiver that we are to look at these areas of nursing
Mhm.
because a lot of things are changing. Transition are not waiting for you to get caught up. I know, like you mentioned, change is something that is really uncomfortable for everyone, not just nurses, but you will need to get to that level where you adapt to the change. Okay, you allude
Yeah.
yourself to the change. Okay, so final words. What advice will you give to nurses who feel stuck or limited in their profession?
Okay. That's yeah, actually very good question. You know, if you feel stuck in what you're doing, then that means there's no gratification there. That is when you start having night terrors to go into work the next day. And I don't think it's worth your blood pressure and your cortisol levels. It's no good. Okay. So this is where I talked about this is where you should start thinking. One is either you are getting information and developing yourself, whether in a different jurisdiction or whether in a different career path. I don't care how long you've been in nursing. You have to have, I always say, my husband will say, is you think every nurse is like you. You have to have a little bit of joy in you to be a nurse. Because if not, then you are that nurse with one, no empathy and no compassion. You treat people as numbers.
Mm,
Even when you are tired, you have to have a little bit of gratification. So if you are feeling stuck, you have to find other ways. People from Emerge suddenly start going back to school to take nephrology. We have people in nephrology saying, now I want to become a certified diabetic educator. Nursing is an autonomous practice, and we're very lucky because it's huge. You don't have to do one thing. So start asking yourself, how can I be better? And start doing something outside nursing. This is where people don't want to hear it. I wanted to work at Winners, something totally different. One, I'll get the discount, and two, I wouldn't take care of any patients, right? So think of other ways because that might be where your gratification and your purpose comes in, right? So start with asking yourself questions and start looking at other ways where you can never go wrong with information and developing yourself,
yeah.
right? So that's what I would say.
Okay, so in the line of recognizing nurses this week, I think next week is Canada, this week is about US.
Yeah.
In line of recognizing nurses, I think this is where we draw the curtain. Okay, do you think nurses get a lot of recognition, enough recognition for the leadership role they play? Do you think we're even recognized at all?
I think
This is
we
not
all get
against
it.
one week.
I think we all know this answer. No, 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 and no. In a hospital, and we've all been hospital nurses before, it's chocolate here, ordering pizza here, $5, $10 gift certificate here. And how long can we do that? The impact nurses have in our healthcare system is huge. And we're not talking about Canada or US. Go to Africa and see. When I was raised in Ghana, and it was the midwives that deliver babies, in the homes. Nurses, community nurses go school to give it's the range of nursing scope is huge. So we don't get recognized. We don't. And in even in academia,
Yeah,
yeah, they will rather give you a lot of, achievement to read, but to actually say, I mean, there are excerpts here and there mentioning nurses, but I don't think actually planning an event just to honor nurses and the leadership role and how compassionate they are and influencing our healthcare system. No, that,
yeah.
yeah, it's not.
Thank you so much. So, guys, you see what I said? If you find one nurse around you today, whether in the bus station, train station, just say thank you. That alone would go a long way. Okay. Even as we round up this week, like I mentioned, be intentional in saying thank you because a lot of us, you have been in, or encountered nurses, in fact, from the day you're born. You will
Yeah.
encounter nurses all through the transitions of your life. So just be grateful to anyone you see around you because they do so much. You might not see what they've done, even when they're retired, it's still nursing.
Yeah.
Because I have some of them who are still prescribing, who are still in the family where they take them as their
Yeah.
demi doctors and nurses. They're still doing something there. So whoever in your family or around you, just appreciate them the much you can. Okay. Until we come your way tomorrow again as we round up this week. Be you, do you, and God bless you all. Have an amazing Friday evening, everyone.
Happy Nurses Week.